Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. We are wrapping up American Heart Month this week, and we're talking about congestive heart failure. Joining us this morning is Dr. Loai Maroof. Thank you so much for being here. We appreciate it.
Thank you for having me.
Tell us a little bit about what is congestive heart failure.
Yeah, so congestive heart failure, or more simply put, heart failure, is basically weakness of the heart muscle. So any inability of the heart to pump the blood forward will cause the blood to start to backfill, and then the fluid components of the blood will end up in the lungs and the abdomen, down into the ankles, and that's where the term congestive heart failure will actually come into play.
Now, if you're having some signs and symptoms, what should we watch out for those?
Yeah. So the most common signs is typically shortness of breath, usually with any physical activity. So if someone were to start noticing shortness of breath, particularly with any physical activity that they were able to previously do without a problem, that may be a sign that the heart is just not keeping up with them. Shortness of breath can also occur at night. Typically people can wake up in the middle of the night short of breath, gasping for air, or an inability to lay flat on their back in their beds at night because they find that they're getting short of breath. Swelling, particularly in the legs, is another common symptom to look out for, or fatigue that's kind of out of proportion to what we're normally accustomed to. That may also be a sign of heart failure.
Wow, okay, so those are some great tips. Now, are there some simple just treatment options for people?
Well, the treatments unfortunately are not simple, but they are useful, and they are help people get to a place where they feel better.
Yeah.
So the first thing that we need to assess for is to decide if any of the weakness of the heart muscle is related to blockage. We will commonly see, as a consequence of a heart attack, damage to the heart that can result in congestive heart failure. So simply put, if there is a blockage, we need to take care of it. So that may be with a stent, or in more complicated cases with bypass surgery. But once the blood flow is restored to the heart, we need to consider medications to help re-strengthen the heart muscle, as well as to treat the underlying causes. In some situations, we may need to consider more device therapy, things like defibrillators, that will help to prevent them from having life-threatening arrhythmias.
Right.
And in advanced cases where they're more sick, we may need to actually refer them down for heart transplantation or mechanical assist devices to help them survive and live longer.
But there is treatment available, so why is it so important to get this condition treated?
Yeah, so it really should not be ignored. This is a long-term chronic condition, and people who have congestive heart failure are at much higher risk of having sudden cardiac arrest, so they can die. However, with the right treatments, with the right therapies, we can prevent that, and people can still live long, healthy, and full lives.
What would you say, doctor, would be the first step you should do if you are feeling some of these signs and have some of these symptoms?
Yeah, it really depends on the severity of the symptoms. If the symptoms are gradual, if you just notice something's not right, first thing you should do is bring it to your doctor's attention. Your doctor may elect to do a test called an echocardiogram, which is an ultrasound of the heart that gives us an idea of what the heart pump capability is. And if there is concern that there is weakness of the heart muscle, they may refer you to a cardiologist for further evaluation or treatment. Now, in situations where symptoms are abrupt, they're very severe, they're getting worse, that's not something we want to wait on. We would advise people to go to the closest hospital and get checked out in the ER.
Okay, now, what would you say about, we can just tell, just from what you're saying, you're very passionate about what you do every single day. Why is that? Where does that passion come from?
Yeah, well, I think it stems from being able to make a difference.
Yes.
We live in a time and an age where we have so many technological and medical advances that we're making a huge impact on people's lives. They're living longer, fuller, healthier, happier lives, and it's exciting to be a part of that, so it motivates us.
And we do appreciate all that you do. Thank you for stopping by. I appreciate that.
Thank you for having me.
And if you have any information, if you'd like anything about today's topic or heart health, just head over to the hot link section on WNEM.com.